Okay, so let's get started. Um, so thank you guys for joining me tonight. We are in our third day of National Public Health Week, and I'm very excited. We're using our theme, looking back and moving forward, a pharmacist's role in healthcare. And thank you again. So I really wanted to thank you guys. Please share it as always. Share the video or live stream if you're watching the replay. And again, you'll be entered in the giveaway. So let's get started. For those of you who may not know me, I am Dr. Laquita Johnson, and I am a population health consultant pharmacist. I specialize in empowering patients to be proactive in their health. I empower pharmacists to be better and frontline healthcare practitioners, and I impact the American healthcare system. So, welcome and thank you. I just want to give a special thank you to the pharmacists, the pharmacy interns, the pharmacy technicians. Thank you so much for risking your lives to save many lives. Thank you for the countless hours you stay in the pharmacy. Thank you for just being the frontline healthcare workers that are easily accessible in every neighborhood. You are in constant contact with patients, with deliverers, with any other essential pharmacy personnel, and I just want to say thank you, and you are very appreciated. So honestly, thank you. And I want to begin because we have so much to talk about. And I want to commend each and every one of you, the pharmacy personnel. Thank you. You guys have been answering the phones, and I know it's hectic. And I know you answer all the questions that people are in such a frantic state. Thank you for your patience. Thank you for your kindness. Thank you for dispensing those 90-day supply of medications, prescriptions, because I understand that it's already a lot to dispense the 30-day, but then for you to dispense the 90-day, it's a lot. So I want to say thank you so much. And then I know you guys have been providing consultations consistently, providing consultations, trying to recommend over the counter medications that can boost the immune system. You have been, again, providing any of all your expertise. Even now, I know that all of a sudden everyone wants to get their flu shot, and you have to take time out. Just really thank you. Thank you. Thank you, thank you, thank you. And I really want to commend the state pharmacy associations. Thank you guys for being proactive and wanting to change and increase the change, like in our profession. Just thank you so much. Because I see that states like California, you guys have already have existing law that's in place that allows the ability to practice mobile pharmacy, doing a declared federal, state, or local emergency under certain conditions, and we are in those certain conditions. Thank you for having that law already in place. Thank you to Florida, who is advocating to expand the scope of pharmacist practice. Thank you, because you see the need for us to test and treat and for us to perform those tasks without the supervision of a physician. Thank you. Also, want to especially shout out to New York. You guys have developed a 6-point plan to address the outbreak, which includes lifting the testing restrictions for COVID-19 and administering vaccinations for the virus when it comes available. Because we already currently administer vaccinations, not just flu, but hepatitis, tetanus. Like we do so much. Thank you. Also, thank you for providing guidance on the actions and authorities affecting pharmacy. You guys, the National Alliance of State Pharmacy Association, special thank you because you guys have provided a resource, an all-inclusive resource for every pharmacist regarding every state regulation that has changed, information about what the health insurers are doing, information about what the governors of each state is doing. You have provided a definite resource, even to the point of which what every state says about the dispensing of hydrochloroquine, chloroquine, and azithromycin. Thank you, because we needed that resource. And I really want to thank you guys for that. And they are also known as NASPA. So if anyone wants to go in, it's called NASPA, or their name is NASPA, National Alliance of State Pharmacy Associations. Thank you for breaking it down. And as you can see, I'm not going to go into details because we have already taken the steps. I just want to provide the information so you can go and look. To anyone that's watching, go look, because the pharmacists, the state pharmacy associations, and the professional pharmacy organizations, we are moving PharmD forward. Thank you. And as I mentioned, I want to thank the professional pharmacy organizations. You guys have came together. And when I say the pharmacy organizations, I just want to make sure people are aware of APHA, American Pharmacy Association, the American Association of Colleges of Pharmacy, AACP, ASHP, the American Society of Health Systems Pharmacists, as well as NASPA, the National Alliance of State Pharmacy Associations, the National Association of Chain Drug Stores, the College of Psychiatric and Neurologic Pharmacists, the Accreditation Council for Pharmacy Education, the Hematology Oncology Pharmacy Association, the National Community Pharmacists Association, the National Pharmaceutical Association, the American Society of Consultant Pharmacists. Thank you. Thank you for writing, for advocating to the White House coronavirus task force and making these four recommendations, because we as pharmacists, we need to authorize, test, and treat and immunize any vaccinations that comes available for COVID-19. We are already accessible to many Americans. There is a pharmacy located within 5-10 mile radius in every neighborhood. We are accessible. We can treat. We need to ease our operational barriers to address workflow and workforce issues. Being that if we can allow pharmacists from other states to come and practice in our states who are not licensed, but as long as they have a valid license, I think that is commendable and is needed, because already as a profession, we are strict by our licensures, our license in every single to be licensed in every single state, instead of just having some type of cohesiveness where we can travel to different states and practice, especially neighboring states. Thank you for addressing the shortages and continuity of care, because we do conduct therapeutic interchange and we do provide substitution without any physician authorization. We do need that, and especially when it comes to not having a physician to authorize when we have product shortages. I remember when there was a shortage of just simple prednisone 20 milligram, and we had to call the physician just to authorize that we can, instead of having 20 milligram, we can dispense prednisone 10 milligram. Prednisone 10 milligram to equal the dose of the 20 milligram. That's why we need to be able to conduct therapeutic interchange and substitution without physician authorization. When in terms of product shortages, we need that. We also need to remove any kind of reimbursement barriers. In terms of the day supply for co-payers, because we don't want Americans or our patients out, but we're going to force them to come monthly to a pharmacy where there are many people every day, which increase the risk of transmission. So again, thank you to the professional pharmacy organizations. Thank you so much. But our next steps, pharmacists, we need to advocate, advocate, and advocate. We need to make sure that every profession knows our value. Advocate what you are doing. Advocate how you went above and beyond to help a patient. Advocate the vaccinations you administer because people are feared and therefore they want their flu shot. Advocate the pharmacists, because state boards have allowed pharmacists from other states to come and practice in their state. So advocate, show that you are traveling and practicing in another state, even though you are licensed in another state. Show a picture, advocate. Send that to your local representatives, your state representatives, to the boards, to all the organizations I list. Just pick one, if not all. Advocate. And I want to say one more thing about those organizations. Thank you guys, because you have provided so many webinars and information to pharmacists and provided so many CE credits. Thank you for that. And thank you for listening to me. As all week, there has been a theme, and we're going to continue the theme. Today's giveaway is a complimentary NAPLAS Mastermind call with me, and it's targeted towards fourth year students, because I know it is a lot, and I know that you may have started studying for the NAPLEX, may want to start studying for the NAPLEX, but you don't have that motivation, you don't have that clarity, you don't have the steps of how to break down all this material and to study. So if you would like a company NAPLEX Mastermind call, all you have to do is like this page, Dr. Laquita Johnson PharmD Facebook page, share this live stream, replay our video, and use the hashtag PharmD moving forward when you share it.